Welcome to Medically Speaking. My guest today is Dr. Katherine Bethin from Oishei Children's Hospital, UBMD Pediatrics. Doc, thanks for joining us today.
Thanks for having me today.
So June is Pride Month, and there's an awful lot of celebration going on across not only Western New York, but the state and the nation. Something that you're familiar with, the work that you do. If you can, let's talk about some of the health disparities that that community is currently facing.
Well, there is a lot of people who are not accepting of them. And so it's harder for them to get services, especially in some states that have passed laws making it illegal for doctors to treat these patients appropriately. I think that having a supportive family is very important. And I think some of these kids are lacking in families that understand what they're going through. And then there's finding a mental health provider that has experience with youth that are transgender, as well as coverage, insurance coverage for treatment.
Gotcha. Let's go back to the disparities topic, especially when it comes to barriers. You find in your work that there's barriers in terms of therapy that your patients encounter?
Yes, at almost 100% of the time, I have to do prior authorizations to get their treatment. And sometimes they still deny it, and I have to figure out which drug they're going to cover.
And that's accessing what types of therapy, what types of drug treatment are you talking about in particular?
So the puberty blockers and sometimes the gender affirming therapies, which are the older kids, we use that if appropriate. But the puberty blockers are extremely expensive, and sometimes it's difficult to get coverage for that.
So you mentioned those types of issues that you're dealing with. And earlier you talked a little bit about even the challenge with family support. When patients and their families are hearing things like puberty blockers and gender affirming therapy, that does pose a challenge in some families from the sense of acceptance. Talk a little bit more about what challenges patients face and how you as the physician kind of interact with both the patient and their family.
Well, some of the supportive families are afraid that nobody's going to treat their child, so they don't even know about the services and are quite relieved when I talk to them about how we can approach things. Unfortunately, some of the families just think that their child doesn't know what they want, and so they're not willing to support them to investigate this further. I try to really convince those families that temporarily using puberty blockers is not going to harm their child, to give them more time to work through these issues. And sometimes I can convince the less affirming parents that they'd be willing to do that. The other thing is getting them to see a mental health provider, which sometimes people are against that just because mental health is not really talked about enough. These days, maybe a little bit more than it used to be, but there's a stigma that people think that I'm saying they have a problem when they don't.
Sure. And I think, COVID-19 has only exacerbated the importance of mental health and mental health therapy, in particular for the LGBTQ youth. Why is that mental health service so important as they go on this journey?
It's important because adolescents particularly are exploring their identity, and the mental health provider can help figure out if this is really how they're identifying, or if there's other mental health issues that are causing them to think that this is what they want. And it's a tough journey. I mean, number one, there's the haters out there. And number two is there's changes to your body that aren't exactly what you might expect, and they need to know what to expect. There's also silly challenges with changing your name and your gender. Now, it's getting more acceptable, but there's still barriers because, oh, your health insurance is under this name and you want to go by this name and they don't match up, then that can be a struggle.
So stay on the health insurance topic. You mentioned that earlier in terms of it being a barrier. What are some of the conversations that you have with the families in terms of what's covered, what may not be covered? Then, what are some of the discussions you have with the payers to make sure that this community isn't marginalized and they are, covered for these types of treatments?
Well, I just fill out the prior authorization, and I will do a peer-to-peer review if necessary. For the puberty blockers, there are alternatives for, say, stopping periods that are much cheaper that we can use. So we'll go down that route if we can't get the puberty blockers. The last 5 years, there's been better coverage, but we still struggle with the Medicaid populations that the insurances that cover Medicaid can be a little bit more challenging.
You mentioned earlier conversation with families and, they find that relief when they, or even the patients find relief that they understand that there is access to the necessary care that they may be in need of or in search of. What are some of the implications for someone, a patient, who may not have that access to care if a community, a city doesn't offer that type of treatment?
So we discovered a little over a year ago that patients were unaware that they could get treatment in Buffalo, and the kids were actually going to Rochester. So we started a gender health center and have been trying to get the word out there. We've communicated with GLIS Western New York and the Pride Center so that they know about us and can refer patients to us and that they don't have to travel so far. But we've had a large number of kids coming, so we don't always get them in as quickly as they'd like to be seen, but hopefully we can expand our services.
So final question, you said, you've had a challenge over the past year. It's getting better in terms of getting your message out. You got 30 seconds here to tell the community, about all the great things that you guys are doing. What's your message at this point? It's Pride Month, your opportunity to talk to the community here.
So the important thing for children and youth especially, or anybody, is just let them be who they are and support them, whatever they want to be. Just love them, and that everyone is a human being and we all deserve to be treated with respect.
Doc, just a great compassionate message, a great way to end our interview today. Thanks for joining us on Medically Speaking.
Thank you.